A very good evening. This is Dr. Chitra. I'm an associate professor of endocrinology at Ramaiah Medical College, and I'm glad that I'm here this evening to talk to you about a very important condition, which is PCOS or polycystic ovarian syndrome. And we know that it is an extremely common condition, and we have now women coming in to the hospital themselves telling us, I have polycystic ovarian syndrome, right? So that's how common it is. And it is the most common endocrine condition amongst women in the reproductive age. So that is why it is so common. It is a conglomeration of symptom complexes which make the disorder's diagnosis. It usually has features of irregular periods. The periods are very likely to be delayed beyond 35 days, or very uncommonly, the cycle length can also be less than 21 days, that is less than 3 weeks. So if you're having cycles delayed by more than 35 days or less than 21 days, that's one of the features. The second common feature are either having increased pimple or acne on your face, and also some other individuals can have increased hair growth in unwanted areas of their body. For example, the upper lip, the chin, the cheek, maybe the abdomen, thighs, back, and chest. Very often we have women coming and saying increased hair growth on the forearm or on the legs. Those are not areas which are traditionally androgen dependent or testosterone dependent. So those are not features related to PCOS per se. But hair growth present on the other areas that I told you about are very likely to be related to PCOS. Very rarely you can have women who have irregular cycles but who don't have acne or hirsutism. But when you do an ultrasound to look at their ovaries, you might find cysts in their ovaries. So having any two of these three factors that I've listed out would make a diagnosis of polycystic ovarian disease or disorder. Now, there are numerous other conditions in our world which can present very similar to PCOS, and that's why when you go to meet your doctor with these complaints of irregular periods or increased hair growth or acne on your face, your endocrinologist is very, very likely to ask for a few set of tests, because hypothyroidism, which is a very, very common thyroid condition, can mimic and present exactly like PCOS. So if you have hypothyroidism and if we treat hypothyroidism, it's very likely that your irregular cycles or the acne or hair growth will go away once we treat your thyroid illness. There are numerous other conditions related to hormones. For example, there's a condition called as Cushing's syndrome, in which there is excess cortisol or steroid levels in your body, which can also present with irregular cycles. We have rarer hormonal conditions like acromegaly or glucocorticoid resistance, which can also present like PCOS. Prolactin abnormalities. Prolactin is another hormone which is secreted by your pituitary gland, which is primarily spoken about in the context of breastfeeding, right? It's the hormone which mediates lactation or breastfeeding. But if you have a lesion in your pituitary in which there's excessive secretion of prolactin, you could have irregular cycles and increased hair growth on your face. So that's pretty much why your endocrinologist is very likely to ask for a set of tests before they make a diagnosis of PCOS, because PCOS is a diagnosis of exclusion. You exclude all of these common conditions which can be addressed or treated, and if none of that is found positive, then we make a diagnosis of PCOS per se. Now, why do we get PCOS at all, right? That is the common condition which plagues so many young girls, adults who are going through the symptoms complex which are related to PCOS. Now, honestly speaking, we don't really know why PCOS occurs at all, but we have some hypothesis which we have able to strengthen and formulate over the years. There's a very strong genetic factor which is playing in to the pathogenesis of PCOS, which means to identify whether you're at risk for PCOS or not, if you just quickly go back and find out menstrual history of your mother, your aunt, your grandmother, and if they had irregular periods to start with, or if they had trouble conceiving, it's very, very likely that you're predisposed to it, right? There is also another family history which could potentially help you identify whether you're at risk for PCOS. So if you have a strong family history of type 2 diabetes, if you have a strong family history of hypertension, if you have a strong family history of heart disease or cholesterol abnormalities, those are also again history to suggest that you are probably predisposed to getting PCOS. Now you must be asking me, I came in with complaints of irregular periods and you're asking me to correlate that to a family history of type 2 diabetes or hypertension. What's the connection or what's the link, right? So the link between all of these abnormalities and let's say PCOS is the fact that the soil for the origin of both of these disorders or all of these disorders is insulin resistance. Now, insulin resistance is just a fancy word to tell you that the insulin which is produced by your beta cells in your pancreas is not able to do its job. Its job is to push glucose into cells. Now, the most common reason for insulin resistance is the fact that the environment that we live in does not allow too many opportunities for physical activity, and also we have access to very high energy dense food really at the beck of a call, and all of these factors have led to increased obesity and overweight trends world over, and that's one of the reasons why insulin resistance is high. So if we have insulin resistance, some of us women get irregular periods and increased hair growth or PCOS. Some of us can get diabetes, some of the others can get hypertension, or even the women with PCOS can still get diabetes and hypertension as they age. Does that make sense? So the soil is the same, the manifestations are different. So one notion that I want to change about PCOS is that PCOS is not a reproductive disorder for which your gynecologist is going to give you the solution. PCOS is a manifestation of metabolic manifestation of the fact that the environment that our body is currently placed in is not conducive for its optimal functioning. So that would also be the reason why almost any doctor that you meet with to address these complaints of irregular periods and increased hair growth will invariably start with how many minutes of sleep are you getting? How many minutes of exercise are you getting? Have you been gaining weight recently or has your weight remained stagnant? Because that's predominantly the same three spokes of the wheel that you will need to address to bring down your symptoms related to PCOS, and also for us as doctors to prevent the onset of metabolic disorders like diabetes and hypertension. So women who have PCOS are at increased risk for what is known as gestational diabetes, the kind of diabetes which gets diagnosed during pregnancy, or even type 2 diabetes later in their life, hypertension, heart diseases. So it's generally believed that women are at less risk for heart disease. That is no longer true, especially in the context of presence of type 2 diabetes. So it is very important that we make the connection that if you have PCOS, you are at risk for all of these. And while you're meeting your doctor to deal with maybe the increased hair growth or irregular cycles, you might also need to at least screen yourself for your cholesterol and blood sugar levels as well, right? So the genetic part of the pathogenesis cannot be altered. We can't change our family, neither can we change our genes. But what we can absolutely change is the environment that we live in. So the environment is affecting us. Like I told you, there's very little opportunity and scope or motivation even to encourage physical activity. There's also access to high energy, dense food at frequency, which is quite difficult for your body to cope with. So, the first few steps of dealing with this begins by addressing certain changes in your food, which is likely to make it healthier, and also reduce the amount of processed food that you're consuming, because processed food could contain a whole lot of endocrine disrupting chemicals which can mimic the hormones which are produced in our body and thereby create havoc inside. And lots of processed food do contain a good amount of these endocrine disrupting chemicals. So one of the first things that we do tend to address is the amount of intake of processed food on a daily basis or a weekly basis, and also indulging in any form of physical activity for about an hour every day at least. So the trick is to log in more work on your free days, but also making sure that you're logging in some work on your bad days or your most hectic days, right? Because this is not something that we do for a couple of months and we stop. This is something that we train ourselves to get used to and make a habit out of and continue to indulge in, not just to tackle the irregular periods or the hair growth, but also to reduce our risk of metabolic disorders like diabetes, hypertension, and heart disease going on further. There's also some other conditions which are common or more common to occur in women with PCOS, right? Eating disorders are said to be more common in women with PCOS, especially women who have increased hair growth on their face or acne, right? Or in whom the androgen levels are high. Now, this is a condition that we are just beginning to understand a little bit more in detail. What are eating disorders, if you ask me? So the world seems to know few eating disorders like anorexia or bulimia, where you're very likely to have low body weight, but there are the other kinds of eating disorders. For example, you could have what is called as binge eating disorder, right? So binge eating disorder is where at one instance you have eaten a more than normal amount of food with an inability to stop the eating spree, although you are aware of the fact that you are eating more than what is normal, and following which you end up with a feeling of guilt. So that's a binge eating disorder. Then another common form of eating disorder is night eating disorder, where you consume more than 25% of your daily caloric intake during night time, right? So you have 3 meals a day as usual, and then during the night, over an hour or so, you end up eating maybe 2 bags of fries and something else, and that would very easily be 25% of your intake, and that's night eating disorder. And these eating disorders do play havoc when it comes to metabolic perturbations, but they're also more commonly found in individuals who have PCOS, right? Another condition, which is obstructive sleep apnea, is also common. Obstructive sleep apnea is where during your sleep you tend to go into periods of not breathing for a few seconds, maybe 3 to 5 seconds, and then you wake up again, and then you go deeper into sleep, and then the whole cycle recurs, right? This is what is called as obstructive sleep apnea. It's related to the fact that your airway collapses onto itself when you go into deep sleep. So the entry of air through your upper airway comes down, and you actually pause for a few seconds. And then, because when you go into apnea or pause, the percentage of oxygen saturation in your blood dips down a little bit, and your brain wakes you up, and then you wake up again, and you beginning to take deep breaths again. And this cycle goes on and on. So what happens is you're just cycling between oxygen saturation dropping and then you waking up. So you're not getting restful deep sleep, which is a factor which could then translate into you waking up groggy the following morning, or being very drowsy, let's say post lunch or mid morning during your meeting or while driving your car. And it could also lead to increased hypertension or increased risk for diabetes or even worsening of blood glucose control. So we are still beginning to understand why this is happening, but I know for now that this is occurring more common in women with PCOS. So I'm sure the question that you want to do is, so what am I supposed to do if I have PCOS? Okay, so I think a lot of women with PCOS go through a lot of body image issues, a lot of anxiety around body dysmorphism, the way they look, and all of it. It's also noted that there's an increased prevalence of depression and generalized anxiety in women with PCOS, especially the women who tend to have very troublesome cosmetic changes on their face. So it's important to first understand that there's probably nothing majorly wrong with your body per se. Most of the changes which are happening to you are probably related to the environment over you. So you work with kindness and you begin to make changes in your life. It need not be anything Herculean, any let's flip this whole thing down today kind of an attitude, but it could just be simple changes which we effect consistently. I think the trick is in consistency than anything else. So if you cannot afford to take that hour off to get your exercise, and in today's world if you're not able to hit the gym, it doesn't matter. Take about 20 minutes in the morning when you're feeling your best, when your motivation levels are highest. Capitalize on that and get about 20 minutes of exercise at the start of the day, and through the day try and break your periods of inactivity where you're seated on your chair. So let all your phone calls be when you're walking about, or break your work every hour or so for, let's say, 30 squats, holding a plank for some time, or maybe some jumping jacks, whatever it is, to just break away the physical inactivity through the day and accumulate about 10,000 steps per day, right? So if these can be worked into your day, but it just needs you to probably keep a tab on it, be aware, be mindful of what's happening, and also understand that lots of people are to gain lots by the food that we choose to put into our stomach. A whole lot of processed food is cheaper than healthier food for obvious reasons, right? But we must begin to understand that they have various effects on our health, which is probably okay once in a while, but not very okay if it's something that we've gotten into the habit of doing regularly. And the thing about food is that if you're not mindful, if you're not watchful of what's happening, it's very likely to become a habit which is quite difficult to break out of. So sit down, audit your day, audit your eating habits, have a food log or a food diary to keep track of what you're eating. Also try and understand the connection between your emotions and your eating. Are you likely to eat poorly when you are stressed out? Are you likely to eat when you are bored? Are you likely to eat when you are hungry? So those are all cues that probably being more aware is likely to help you understand how it's going about. And for the management of the complaint itself, so if you have irregular cycles, what am I supposed to do? If I have increased hair growth, what am I supposed to do? So the baseline of it all is the changes in the lifestyle that we spoke about, which we will definitely try and make sure that we are all moving forward with every single consultation. So we're getting better today than the previous consultation, and the intention is to move forward for the next consultation, right? But going for long periods of time without having cycles is not really encouraged. So if you've not had a cycle for more than 40 days or 45 days, your endocrinologist or your gynecologist is very likely to prescribe a progesterone tablet course for about 5 days to make sure that you have a cycle. And this is important because if you have endometrial growth which is the inner lining of your uterus, go on for more than 40 to 45 days, sometimes that growth can be abnormal, leading to precancerous growths inside your endometrium. And that's one of the reasons why your gynecologist or endocrinologist is likely to freak out when you say that you haven't had a cycle for 3 to 6 months, because every single one of those times when you've not had one could potentially mean that there could be increased risk of abnormal growth. So all we need to do is track our cycle, and if it's not happened in the last 40 days, with the supervision of your gynecologist and endocrinologist, you go on a progesterone tablet, following which you will have a cycle. And as you are making these lifestyle changes and exercising and eating better, even if your weighing scale does not move, and I say this all the time to my patients, that weight is a very inaccurate tool to assess health. Your weighing scale might not move at all, but if you're exercising and if your cycles normalize, that's an indication that your body is grateful for that exercise. So you stick to that exercise, right? So that's what we do. And if the hair growth is too much and if the acne is too much, sometimes we might need to choose the help of medications, for example, like anti-androgens. Now, anti-androgens are medications which block the effect of androgens in women. So you must be wondering, why are women having androgens? When you have insulin resistance, the amount of androgens in women can go high, which manifests as increased hair growth and acne. So we might give a medication to block the effect of testosterone, or sometimes we might give you a dose of estrogen and progesterone, which will clamp down your entire hormone production system and bring everything under control. So when it brings everything under control, it also brings down your testosterone levels under control. So your acne and hair growth is likely to improve. One word of caution for any girl or woman who is on oral contraceptive pills or estrogen containing pills for acne and hirsutism related to PCOS, please know that estrogen pills could increase the risk of clots. There is something called as deep vein thrombosis, where there's a clot in the deep veins of your legs or lower limbs, or sometimes it can travel up to your lung and cause pulmonary embolism. So that's a risk which is known. So if you have any pain in your calf region, or if you have any difficulty in breathing while you're taking these pills, you need to report it to your doctor immediately. And this is, it's not uncommon, it's quite common, and it can be quite devastating if it happens at all. And never double dose, overdose on your estrogen containing pills, right? So if you miss a tablet today, usually there are courses which last for 30 days. So if you miss a tablet today, don't catch up the next day. Don't take two the following day. That's not recommended, because then you're likely to add a large dose of estrogen to your body, which could potentially increase your risk of clots. Make sure you're active. Inactivity also increases risk of deep vein thrombosis. This is the same deep vein thrombosis that they warn you about when you're on long haul flights. They ask you to keep moving about, move your legs in circles, drink enough water. So that's something to be kept in mind. And it's also important to be aware that women with PCOS, especially who are in their 30s or 40s and onwards, are very likely to have some risk factors related to heart disease. It's important to screen yourself for it. So quickly to summarize, it's a very common condition. If there's a family member with PCOS or gestational diabetes or hypertension, you're likely to be at risk. Many other conditions like thyroid, prolactin related disorders or Cushing disorders are very likely to present exactly like PCOS. So meet your doctor to rule out these conditions. It presents usually with irregular cycles, increased hair growth or acne on the face, or ultrasound showing features of cysts in your ovary. If you have 2 out of these 3, you make a diagnosis of PCOS. It has both genetic components and environmental components. Genetic components is how you identify with a family member. Environmental factors are usually related to the fact that we are overall the prevalence rates of obesity is rising, and we are not exercising as much as it is considered normal for your body. So those are some changes that you can easily implement. It's important to understand that PCOS is not just a reproductive disorder. It is a metabolic condition which comes with increased risk of diabetes, hypertension, diabetes during pregnancy, heart disease, and even some rare cancers related to the endometrium. So meet your gynecologist, talk about how you can make lifestyle changes and implement them. Also understand that this is also one of the most common conditions for infertility. Women with PCOS are at increased risk for eating disorders, obstructive sleep apnea, and also body dysmorphic disorders and anxiety and depression. So most women are relieved to hear that it's not your body that has a condition or an illness. It's the way that your body is unable to get acclimatized to the environment that we've created for ourselves in modern life. So it begins by changing the environment, and there's nothing much wrong with your body. And I'm hoping that I have helped take away some of the myths and misconceptions about PCOS to this audience today. And thank you so much for logging in. If there are any questions, I will take them. So looks like there are no questions. Thank you so much. Thanks for logging in, and take care of yourself and stay safe. COVID-19 is very much here. India is recording very, very high number of cases. Please wear a mask all the time and stay healthy and stay safe. Thank you.